All right, here we are, Psych 2, looking at part 2 of psychological disorders. We're going to look at schizophrenia. What is it? The positive and negative symptoms of schizophrenia, as well as the types. There's 4 types we'll look at. And then we'll look at mood disorders. And then lastly, we'll look at personality disorders. And again, don't self-diagnose. All right, enjoy. And when this is done, we have just 2 more weeks, so keep up the good work and fight the good fight. Bye now. Okay, schizophrenia, well, by definition, it's a severe psychological disorder characterized by loss of contact with reality, often with hallucinations, delusions, inappropriate or flat affect, some disturbances in thinking, social withdrawal, and sometimes other bizarre behavior. Schizophrenia most often emerges in adolescence or early adulthood. And it can be described in 2 different types of symptoms, positive symptoms and negative symptoms. Now, positive symptoms are maybe ones you're more familiar with, and you'll find these on page 202 and 203. The abnormal behaviors that are present in people with the disorder, abnormal behaviors present in people with the disorder include hallucinations, delusions, delusions of grandeur, delusions of persecution, grossly disorganized behavior, and inappropriate affect. Now this detail, you'll find descriptions of this on page 202 and 203. Now the negative symptoms of schizophrenia, the loss of or deficiency in thoughts and behaviors that are characteristic of normal functioning. Now, these are not always things that we would associate and more overtly notice. They can just sometimes be things that are more subtle. Social withdrawal, apathy, lack of goal-directed behavior, very limited speech, slow movements, poor hygiene, poor problem solving, and a distorted sense of time. Now, you might have chatted with people who might show these sort of symptoms, and you might not say, well, that person has schizophrenia, but the positive and negative symptoms tend to coexist. Now, as I mentioned, there are more than one classification of schizophrenia. There's catatonic, paranoid, disorganized, and differentiated schizophrenia. Now, catatonic is probably the more unusual. This is where somebody will find themselves in complete stillness or stupor, great excitement and agitation the next time, frequently alternate rapidly between these 2 states of complete stillness and stupor and excitement and agitation. They may assume unusual postures and remain in those poses for long periods of time. Now, paranoid schizophrenia, on the other hand, is characterized by delusions of grandeur or persecution. They're convinced they have the identity other than their own, or that they possess great ability or talent. Often they show exaggerated anger or suspiciousness, feel they're being harassed or threatened, may become violent or defend themselves against imagined persecutors. Behavior is not as disturbed as other types. The chance of recovery is much better. Disorganized schizophrenia is the most serious type. Extreme social withdrawal, hallucinations, delusions, silliness, inappropriate laughter, grotesque mannerisms, flat or inappropriate affect, frequently incoherent, may exhibit obscene behavior, may swallow almost any kind of object or material, results in the most severe disintegration of personality, the poorest chance of recovery. And then there, fourthly, is the undifferentiated schizophrenia. This is the catch-all term used when schizophrenic symptoms are either not conforming to the criteria of any of the other types, or they conform to more than one of the other types. Causes include, and we'll see on page 205, there's a graph there, they can include genetic inheritance, diathesis stress model. This is the genetic disposition along with stress that an individual can handle. As we grow up in our late teens and early adulthood, we end up having more stressors put on our life. We might be engaged in paying more bills, going on to an education, living more on our own. And those levels of stress all affect people differently. And most people go through those experiences in a relatively normal way. But for some, if there's a genetic disposition towards schizophrenia, the diathesis stress models would suggest that when the stress gets high enough, it triggers the genetic predisposition, in which case that's when, and that is often why, schizophrenia will emerge in late teens and early adulthood for people. Okay, we're moving into mood disorders, and again, these will be ones you'd be familiar with. Disorders characterized by extreme or unwanted disturbances in emotion or mood. Now, the major depressive disorder is marked by feelings of great sadness, despair, hopelessness, as well as the loss of ability to experience pleasure. Now, the people that I've worked with who experience major depressive disorder are remarkably sad, and over long periods of time, every day, to the point, and as I put the link to a site there, Depression Hurts, where it actually physically hurts the person. Now, the symptoms can include changes in appetite, weight, sleep patterns, loss of energy, difficulty in thinking or concentrating, psychomotor disturbances, slowed body movements, reaction time in speech, constant movement, fidgeting, wringing of hands and pacing, psychotic depression, delusions, even hallucinations. Now, many receive antidepressant drugs. Studies reflect psychotherapy can be equally effective. The reoccurrence of the disorder, well, between 50 and 60% of the patients will have a reoccurrence. Reoccurrence greatest for females, and when the initial onset is before 15. May be frequent or infrequent, but 20 to 35% of patients' reoccurrence is chronic, lasting more than 2 years. Medication, psychotherapy, and social support and exercise are preventative. Now, along the same lines with mood disorders are what's called bipolar disorder. Now, bipolar disorder is an extreme, is in which manic episodes alternate with periods of depression. Usually within relatively normal periods in between, manic episodes are excessive euphoria, inflated self-esteem, wild optimism, hyperactivity, temporary loss of touch with reality. Frequently have delusions of grandeur along with euphoric highs, may waste large sums of money in get-rich scheme, likely become irritable, hostile, enraged, and dangerous if stopped, may be hospitalized to protect themselves from disastrous consequences. This afflicts just under 1% of the Canadian population. The prevalence is equal between men and women. The onset during late adolescence or early adulthood. 90% have reoccurrences, about 50% within a year of recovery. 70 to 80% return to a state of emotional stability. Mild cognitive deficits persist following a manic episode. Many manage their disorder and lead normal lives with the aid of medication. Psychotherapy helps cope with the stress and chronic mental illness. Causes, well, genetic inheritance, the role of serotonin and norepinephrine, including cognitive, which would result in sort of faulty or distorted thinking. And then lastly, we'll just touch on personality disorders. These are long-standing, inflexible, maladaptive patterns of behaving and relating to others, which usually begin in early childhood or adolescence. Characteristics of personality disorders can include extremely difficult to get along with, unstable work and social histories. They know their behavior causes problems, yet they seem unable to change. They blame other people or situations for their problem. Treatment options aren't very many, they're few. Most seek treatment by legal authorities or family members, seldom engage in self-reflection essential for this success. And psychological and behavioral factors that lead to a personality disorder diagnosis may be resolved to some degree or become less severe over time. And what you're seeing in the graph there, or the slide, is the cluster types. Cluster A for unusual behavior, whether they have paranoia or schizoid or schizotypal type, and so they, in order to be, they would categorize the personality disorder by having bits and parts of each category, each cluster. Erratic or overly dramatic behavior, narcissistic, histrionic, borderline, antisocial, or C, anxious and fearful, where you have obsessive compulsive components, avoidant and dependent. So the diagnosis of these sorts of conditions, you need the DSM-5 as a guide to show what the criteria and conditions are for each to be diagnosed, and it needs to be diagnosed by our professional psychologists or psychiatrists to meet the conditions and the criteria outlined in the DSM-5. So I hope you've enjoyed this. This has been Psychology 2, Psychological Disorders, and we've got 2 weeks to go, and we're going to look at therapies. So good luck and keep up. You're doing great. Bye now.